Are you looking for natural, easy, simple ways to reduce the risk of an ACL tear or a re-tear? Maybe you're a youth athlete and you want to prevent injury, or you're in your 40s or 50s and you're concerned that this is a problem for yourself or maybe your family. This episode is going to be perfect for you. Welcome everyone back to the Sports Performance Podcast. What is new? What is better? What is happening to the Sports Performance fam? It's great to be on this episode and sharing with you a couple of different updates that we have. For those of you who've been in town and in our clinics, we've been excited to launch our hyperbaric oxygen therapy. That's been great. All of our clients are giving us great feedback, so that's been fantastic. We've added two new team members since our last episode. And that's one of my favorite parts of being part of sports performance and really contributing to the community is one, most importantly, is helping you, the listener, our clients live a healthier, happier lifestyle. And the other side of that is being able to create opportunities for more team members to be able to help more people. So yeah, it's been great to be able to grow as a family, and that's what's happening new at Sports Performance. All right, on to this podcast. Why are we talking about ways to reduce ACL tears? This has been a hot topic amongst our clients, amongst parents, amongst adults, older adults, veteran adults, and I wanted to share kind of the five things that we've been sharing with a lot of our clients who ask these questions. And what it comes down to is when we look at ACL tears, there's a big portion of ACL tears that not a lot of us understand. It's a very lengthy process. It can take up to a year to recover. And people ask, "Why? I wish I would have known this. I wish I would have, before tearing my ACL, I wish I would have known some of this information." And I'm going to share it with you today. All the things that people have told us that they wish they knew beforehand, or that they're currently in. They just had an ACL tear or a repair and they're recovering. This is also for you because these tips are going to be about how to reduce a re-tear. So both people before surgery or after surgery, or those looking to completely prevent it, these are going to be great tips for you to be able to use inside your fitness routine, your general warm-up, whatever it may be. So here we go. The first one is creating a comprehensive strength training program. Now, I have a lot of parents who ask, well, I don't know a lot about physiology, or I'm not a personal trainer. Like, what type of things can we be doing to improve my strength or my son or daughter's strength or whatever it may be? And it's really easy. Let me describe. The ACL is one of the most important knee stabilizing ligaments. And what it does is it prevents the knee from separating or shifting apart. And when you look at its main function, it's kind of like the brakes when you are cutting or pivoting or straightening your knee. And this ligament is there to support you. And it takes a lot of force for this to be able to tear. And there's different times in people's lives where maybe their knees feel a little weaker. They're not their once strong self that they were when they were 18 or younger. And one of the easiest things to reduce the risk of an ACL tear is to strengthen everything around the knee, everything around the foot and the ankle, and everything around the hips and the core. People say, well, Chris, why is the foot so important? Why is the core so important? Why are the hips? If I'm dealing with my knee, why do I have to strengthen everything above it and below it? Well, your ankle, if it's not very flexible, it requires that your knee takes on more motion. And if your hips are not strong, it now requires that your knee takes on more responsibility. And so if you're looking to reduce the strain of your knee and the ligament that it has to take on. You want to strengthen everything that's above it and below it so that knee is nice and solid and tight, everything from the ankle to the hip to the core. And it doesn't have to be fancy. All you want to do is you want to have a comprehensive approach to this. You don't want to just do your thigh muscles, kind of that knee extension machine at the gym. You don't want to just do knee bending exercises. You don't want to just do running to strengthen the knee. There's a little bit more complexity to this, and ultimately, you're trying to take everything above and below it, make sure it's nice and strong and it's consistent. People ask, Chris, well, how often should I be strength training? Or maybe that's my son or my daughter or myself. The American College of Sports Medicine recommends that we take 2 days a week to have resistance training, and that is 2 days minimum just to maintain our strength. Now, if we want to gain strength and we actually want to be stronger than ever, it's going to require 3 or more days to be able to do this effectively. So you want to build that good foundation. You want to do core exercises, not just sit-ups, any type of balancing or core stabilization activities. And all of these things help stabilize the knee. And so if you were ever going to have trauma or you're ever going to step down from something wrong or somebody was going to hit you from the side, or maybe your son or daughter plays soccer or rugby or whatever that may be, and someone hits them, the knee now has to react and stabilize in preparation or in reaction to that stress. So the way to reduce the strain and the stress and reduce the risk of an ACL tear or a re-tear is have a comprehensive approach to stabilizing and strengthening everything around that knee. That's the easiest way. That's the number one approach that I highly recommend to people. The second one is something we call neuromuscular training. It sounds like a big word, neuromuscular. Ultimately, it's a couple different things. It's a fancy word that we call proprioception. All that is balance. And ultimately, we know that some of us, if you were to stand on your leg right now and you were trying to hold on to nothing around you, and you stabilize for 30 seconds, how long would it take you to put the other foot down? For some of us, it might take 5 seconds. You should be able to confidently do it for 30 seconds without an issue. And then you're going to test the other side. I can barely move my left. I can barely move on my right. And you're going to find that you're going to find asymmetries. One side is stronger than the other. One side is not as balanced as the other. And now you can test it. If you really want to test your balance, do the same exercise. Stand on one leg, try and stand for 30 seconds, and then try and do it with your eyes closed. And that will test how stable you are on one side. And you say, Chris, why does balance have to do with anything on my ACL? The great part is that the ACL is a ligament that's connected to two bones. And what surrounds those bones are ligaments, something called joint capsule, all these tendons, all of these muscles. And those muscles get activated with your balance, all these sensors on the bottom of your foot and inside your brain. And it tells you where you are in space. So if your feet haven't good contact with the ground, and you have good balance and your brain knows where you are and you close your eyes, you're going to take one of your biggest assets to your balance, which is your eyes. If you take your vision away, your balance and then your receptors on the bottom of the foot will tell you how stabilized you are. Now, for some people who tear their ACL, those receptors aren't as reactive. They're a little slower, or they weren't woken up. Maybe they weren't tested for a long period of time. Maybe your 40s and your 50s and you don't do a lot of balance exercises and now it's catching up. It puts you at risk for a higher risk of an ACL tear or a re-tear. So balance and proprioception is a big one. And then the last piece to that is agility and plyometric exercise. Plyometric, that's another fun big word. And all that means is that you're doing fast movements. Maybe you're doing jumping, or maybe you're doing cutting exercises where you're going left to right. And you might say, well, maybe I don't do those on a normal basis, and I'm 40 years old and I don't feel like I need to be doing side to side motions. Now, ultimately, If you're skiing or you're doing activities where you put your ACL at risk, all you want to do is do balance and quicker activities that mimic those things. So maybe you're doing seated squats a little faster, or single leg squats a little faster if you're a skier, or being able to jump onto a small step and stabilize, and jump to another small step and stabilize. And what that does is it tells your body to be ready, to be balanced, and that your muscles and tendons can take on the strain. And when your muscles and tendons can take on the strain, it takes pressure off of the ligament itself. So the more balance you have, the more receptors, the more that they're awake, the stronger the ligaments are, the stronger the tendons are, and the stronger the muscles are. Those all reduce the strain on the ligament itself. So number one, we said, was a comprehensive strength training approach. Number two is a neuromuscular training program. Number three, this is if you were to type into YouTube or Google and you would look up ACL mechanics. The third highest risk for an ACL tear is improper mechanics and jumping or landing mechanics. And what I mean by that is, if you were to jump up high in the air right now, big jump, and then land with both knees or both legs on the ground. For some of you, if you were to jump as high as you possibly could and then jump right back down, you're going to see that both your knees should stay over your feet or over your toes and underneath your hips. Some people's knees go inward or close to each other, like almost like knock-kneed, and almost where if you were looking down at the ground, if your knees come together, you can't even see the floor underneath you. And what that does, that movement is called knee valgus, or just bringing your knock knees coming together. Well, that movement itself puts a significant strain on the ACL. It's actually one of the biggest movements that is actually, or creates an ACL tear, is associated with an ACL tear. So one of the first things that we do when we work with athletes or active adults or anyone who's had high risk or had an ACL tear in the past, we work on proper landing mechanics or jumping mechanics, where we teach people how not to bring their knees together and how to have a soft landing and not have a deeper knee bend. And this allows that person to understand, wow, I was landing so far forward. My knees were coming too far inward. And that is a huge awareness to most people. They jump and do things without any idea that they're actually putting themselves at a higher risk for an injury or a re-injury. So and if you're a youth athlete, or you're somebody who enjoys, weekend basketball or soccer, and you're doing a lot of cutting and agility, we see that a lot of people stand really tall when they cut, and that produces a significant strain on the actual ACL as well. So we work on cutting mechanics where we have people drop into a squat a little bit more, or we have them hinge at their hips a little bit better. And all of these things are done purposely and guided to be able to reduce the strain. So we said number one is comprehensive strength training. Number two is neuromuscular control. Number three is proper mechanics and landing. And number four, ooh, this one's great. This is, you need to have proper flexibility and mobility. Now, some of you are guilty of not being able to touch your toes, or, you feel your hips are really stiff and you can't really move very well. Well, when your hips are stiff or your ankles are stiff, it's kind of like a sandwich. Your hips and your feet are kind of like the buns, and the knee is the meat. When it's really stiff at the hips and when it's really stiff at the ankles, everything now takes pressure onto the knees. So one of the easiest way to reduce strain on the knee is have more flexible hips and more flexible ankles. And people think, well, I've been stretching my hamstrings, I've been stretching my calves, and that's fantastic. But we want to be able to stretch the hips in multiple directions. And if your hip is not very flexible and you go to cut or turn or pivot and they're not flexible, the knee will take all the strain, and that's when the ACL tears. So You want to have a regular stretching program where people say, well, I enjoy stretching and once a month doesn't really count. You really need to be able to consider that you're doing this repeatedly. You're actually doing this 3 times a week, just like your strength training. If you're strength training 3 times a week, you want to associate your flexibility days or your stretching days on the same days. That's fantastic. And the portion of the flexibility and mobility is also doing a dynamic warm up. People ask the question all the time, Chris, how long should I warm up? Is that 30 minutes? Is it 50 minutes? How long? What's ideal nowadays? Honestly, you just need about 5 minutes of a dynamic warm up, meaning you don't need static stretching. You don't have to stand there and hold for a count of 30 and touch your toes and kind of sit there. Current research is showing that dynamic warm-ups are more effective for injury reduction, meaning all you have to do is get blood flow in that area. So if you're going to do a lower body workout, you can be on the bike for 5 minutes. You can go jog for 5 minutes. You can go run and play, shoot hoops for 5 minutes. And ultimately, you're just getting that tissue warm and it gets it activated and ready for what's to come. So we said number one is comprehensive strength training. Number two is neuromuscular training. Number three is proper mechanics and landing. And number four is flexibility and mobility. And the last one, this actually has nothing to do with your body, has nothing to do with stretching, nothing to do with the knee, nothing to do with strengthening or stretching. All this has to do with is the external parts or the things outside of your control that you can control now or be aware of. Number one is the proper footwear. Now, if you have old shoes that are very flexible, almost like sandals, and you don't have a lot of stability in the ankle, what you'll realize is that knee will now twist more and more. So you want to have stable shoes, good firm shoes that allow you to cut and pivot, but don't allow your knee to go everywhere. And all the thing I can tell people is that you want to have good traction and support in the ankle so that that knee is stabilized. Proper footwear is needed, and if you play sports regularly, I tell people to change out their shoes, running shoes, soccer shoes every 3 to 6 months. That allows you to remove the risk of an ACL tear due to improper footwear, something that's very preventable. The second portion of that footwear and equipment is surface awareness. Now, if you are playing soccer and you're on a grass field and you notice that there's a lot of little divots or little potholes inside the grass, that puts you at an increased risk. And I think you have to understand that. Most people say, well, I was playing soccer. I've played soccer my whole life. Yeah, but if you had bad footwear that was 2 years old and you brought them out of the closet, and then also you're played on a very bumpy surface, you put yourself in an increased risk. Worst case scenario, now this person who went out and played soccer, who hasn't played in years, had old shoes. They were on a bumpy field. They didn't stretch. They didn't use a dynamic warm up. They weren't strength training, and they weren't doing any form of agility or plyometric exercise. That's a recipe for disaster, and that's what we call injuries to the weekend warriors. People who literally do this recipe. They're not consistent with playing soccer, playing basketball, and now at an increased age, they apply the same principles that worked when they were 14, 15, 16, and that's when injury happens or re-injury happens. And my goal today is really just to give you more tools to be aware of. If you're listening for yourself, you want to take these tips into account to include into your normal fitness routine. It's not a huge change that you have to make. Just include a small tweaks, 3 days of strength training, 3 days of flexibility training, get some new shoes, do a dynamic warm up, make sure you're aware of your surrounding, and it puts you in a really good position so that you minimize the risk of these things happening to you. So if you've been concerned with an ACL injury or a re-tear, these will put you in the right direction. And for those of you who are looking for, Chris, I mean, now I'm concerned. What do I do? Or I've had these issues and I'm kind of concerned. Or my son or daughter has an increased risk. Maybe you had an ACL tear, or you're concerned that their knees are going to they're going to turn out just like yours. The great news is we created a special program because we've had so many parents and so many people reach out to us and ask, is there anything that we can do preventatively? And the great news is there is. And so we created a very unique, exclusive program for our clients in San Diego and Chula Vista and Kearney Mesa and beyond. And it is called our ACL program. And there's two portions to our program to be able to help clients wherever you are along the spectrum of ACL injuries. We created the first part, which is a prevention program, our ACL prevention program, which helps people, whether you're 15, 30, 45, or 60, learn the proper mechanics, learn the proper drills to set you up for success, and learn safe exercises guided by ACL prevention specialists that we have created a specific protocol that is 6 weeks long that gives you the tools to understand, okay, great. So now I have the first step that is created for you, specifically for you and your mechanics and your strength. And that prevention program is starting this summer, whenever you're listening to this recording, summer of 2024. We're excited to bring that to our community. And the second part of the program is our ACL recovery program. And this is for people who have undergone ACL surgery either recently or in the past. And you're looking for specific specialists who manage and care for ACL injuries repeatedly. We've seen thousands of ACLs at our facility, and we've been able to get people back to the sports and back to the activities they love safely so they can stay healthy and enjoy an active lifestyle. And that's ultimately what you want for you and your family. And so whether you've had an ACL injury and you're looking to get back to sports or whatever it is that you love in a very controlled environment, and I get it, there's a lot of concerns. There's the emotional side, there's the financial side. I don't want to have to go through this again, and that's why we did it, to really give you the best chance to be successful, so you lower the risk of this happening again. And so we're excited to offer both programs, both our ACL prevention program or ACL recovery program, both housed inside the sports performance ACL program. So if any of you are interested, please feel free to reach out to the team at Team SP at sportsperformancept.com, or head over to our website at sportsperformancept.com/ACL. We're excited to help you, your family, your neighbors, anyone you have. And I hope you guys doing amazing. And I will see you guys on the next episode. Take care.